why mental health is certainly critical. Taking care of it, nurturing it should be front and center for everyone. But not everyone has access to the support they need. If you're Black, Indigenous, a person of color, LGBTQ+, mental health in many ways is still considered to be taboo. It's ignored despite the efforts made in the workplace. To talk more about this in our Realities of Racism panel, Agapi Gessesse, Executive Director of the C Centre for Young Black Professionals. Marcy Gray also joins us, CEO of Gray Matter Health. It is great to have you both on the program today.
Thanks for having us.
You know, it's an interesting conversation, and it's an ongoing conversation. I think you both will agree with me on it, especially when we're talking about overall mental health, but then when we're talking about the mental health when it comes to horrific incidences or experiences or acts of racism and hate. What is it like? Let's start with you, Marcy. For those in the Black community, people of color, Indigenous communities, what is it like for them dealing with what is considered to be an ongoing struggle in dealing with their mental health?
Certainly things that happen, like what happened in Buffalo, has really impacted the Black community in an adverse way. You know, it has impacted us again with our mental health. It causes deep racial trauma every time something like this happens. To be gunned down just because of the color of your skin, although it happened in Buffalo, really the Black community here in Canada is feeling the impact of that. And the impact on mental health is that it causes racial trauma. And racial trauma has symptoms such as depression and anxiety and, a lot of feelings of hopelessness sometimes and hypervigilance and just this feeling of unsafety. So it causes such a disruption to mental health.
Yeah, Agapi, hearing what Marcy is saying, and we know that she's been working with clients, you also are working with a number of young Black professionals. When there is that concern, that knowing that all of us have experienced at least, and I'm saying at least with a real emphasis on the word at least, one incident. We know it's always been multiple incidents. For those experiencing that hate and violence, why is it so difficult for them to get the help that they need?
I think that there's a number of reasons as to why. I mean, number one, when something around the world takes place or something in the world and it comes onto the news, we're looking at mass shootings that are happening in schools. All of those things affect all of us. But then when we hear about things that are very intentional towards our community because of something that we really cannot do anything about, it strikes very differently, and it affects us in such a different way. And I think access has a lot to do with culturally relevant accessibility. The reality is, someone outside of our community is not going to understand that type of trauma and that hurt that we're feeling that transcends into all of these other things like anxiety, depression, etc. And so we need people like Marcia who are psychotherapists. We need to be able to go to a culturally relevant place so that people, when we're talking to folks, are not looking at us, as though they can't understand us, they can't relate. And in our community, comfortability is a huge part of opening up, right? It's very taboo in the Black community to talk about mental health, right? And so we really need to be accessing people and services that are culturally relevant and understand the types of trauma that our community is specifically dealing with.
I'm hoping, if you don't mind, I want to get a little bit personal with the both of you because I know you've had a number of experiences, and Agapi, you make a good point, that relationship being relatable. Can you both share with me an experience or two that you both have gone through? Agapi, let's start with you first. I know viewers listening right now will be nodding their heads saying, yes, I've had the same thing happen to me.
Yeah, I think that there's so many instances that I can think of. I mean, especially, taking on the role at C originally, I remember wanting to go around and just share the amazing work that we're doing. And it was so shocking to me, really, how many people actually pushed back and said, well, why are you only serving Black youth? What about everybody else?
Wow.
Don't you think that's reverse racism? And in the first year of this job, it really affected my own mental health because I would often think, inadvertently, you're rejecting me as a person. I'm a Black person. I obviously know that as a woman, I'm facing so many other barriers, and I'm passionate about this work because I want that not to be the case for the young people that I'm serving. And so for somebody to say something like that to me and me having to be the representative to explain exactly why this is needed, you know, that vicarious trauma in those types of situations, even, you know, going to fundraise, you would never really think about that. But when people are responding in that way, you very much feel devalued, and it diminishes the work, but also diminishes the value of the experience that people I serve are dealing with.
Indeed, and it's got so many layers now in terms of how it affects. And Marcy, let's bring you in, of course, on this and your experience. That, of course, coupled within the work that you're doing to help people who are experiencing the same thing that you've experienced.
Yeah, absolutely. So I can say, you know, many years ago, prior to becoming a therapist, when my children were being born, I suffered from postpartum depression and needed to get services and couldn't find any culturally competent services, and was met with a lot of racial discrimination within the system. And of course, there's a lot of stigma and a lot of, you know, difficulty already trying to access the system. And so I have firsthand knowledge of that. And so that's why I work so hard to have so much advocacy about mental health awareness within especially BIPOC and Black communities, but also trying to educate our nonprofit organizations that are supplying some of these services, to let them know that they really need to have an awareness of racial trauma, of discrimination within the systems, and understanding how to really be culturally competent and work with those who maybe don't look like you.
Indeed. My last question to both of you, a simple one, but I think it's a complex answer. Are you hopeful, Marcy? Are you hopeful that things will get better, things will change, that education will receive its merits?
I'm hopeful because I spend a lot of my time doing this work, consulting with organizations, working within the Black community, working with my clients in therapy. So I'm very hopeful. I can see, you know, some small changes. We've got a lot of work to do as a society for sure, but I'm very hopeful that little by little, we can continue to work on this.
Agapi, your last word on this. Can we be breaking down those barriers so that the struggle is not the struggle, but there's access, easy access?
We have to be hopeful. There's really no choice in it, because if we don't press on and we don't continue to make the conversation known and mainstream and continuously tackle this, we're not going to see change, and our community is going to suffer in silence. And I think that hope is a must.
It's a must. It is indeed. And I think the community, we're all very thankful to have both of you at our disposal. You're wonderful, powerful women, and I appreciate you both giving me your time today. Agapi, Gessesse, Marcy Gray, stay safe and well. We'll speak again soon.